Acute appendicitis 10 to 20 years, lymphoid hyperplasia or fecolith obstruction, appendiceal lumen, gut organism invading the appendix, edema, ischemia with or without perforation, abdominal pain, periumbilical, right iliac fossa. Patient often reports pain being worse on coughing. Mild pyrexia is common, vomit in 1 or 2. Diarrhea is rare. Scoring system for liver cirrhosis. Child puck classification severity. MELD recently used. Child puck में biliary, albumin, PT, encephalopathy and ascites. Child puck this is very important actually. तो इसमें severity देखनी है आपने. bilirubin देखते हैं, albumin, prothrombin time, encephalopathy and ascites. ठीक है. 1, 2 and 3 is there. Less than 34, 34 to 50 and more than 50. More than 35, 28 to 35 and less than 28. Prothrombin less than 4 seconds, 4 to 6 seconds and more than 6. I think this is minutes. Encephalopathy none, mild and marked. Ascites again none, mild and marked. So these are BAP. A more than less than 7, B is 7 to 9 and C is more than 9. So this is C is the most severe one in this case. TPMT activity high or normal 90%, intermediate 10%, deficiency if it is 1 in 300, 1%. IBD azathioprine induced myelosuppression due to decreased TPMT. ठीक है, induced myelosuppression. MELD score जो रहता है, this is for recently used. ठीक है. Bilirubin and creatinine and INR, 3-month mortality based on MELD scores you have given. More than 40, 30 to 39, 71% and all that. This is not asked in MRCP. Acute, what you have to take in perspection is that serum bilirubin, INR and creatinine are important factor which are going to determine the mortality. Okay, so bilirubin, creatinine and INR. Acute liver failure, rapid onset of hepatocellular dysfunction, causes paracetamol overdose, alcohol overdose, viral hepatitis which is usually A or B, acute fatty liver of pregnancy. Clinical feature इसमें क्या होगा, liver fail है तो jaundice, coagulopathy के coagulation factors are gone, so prothrombin time is increased, hypoalbuminemia and renal failure. Now LFTs do not accurately reflect the synthesis function of the liver, so it's not a reliable factor. This is best assessed by prothrombin time and albumin liver. HIV, biliary and pancreatic features. Most common cause of biliary disease is sclerosing cholangitis due to infection, CMV, cryptosporidium and microsporidia. Pancreatitis in HIV may be secondary to antiretroviral or by opportunistic infection, example cytomegalovirus. Spontaneous bacterial peritonitis, this is clinical feature of ascites, abdominal pain, fever. Diagnosis paracentesis, इसमें न्यूट्रोफिल काउंट जो है more than 250 cells per microliter होना चाहिए. Most common organism is E. coli. Management is IV cefotaxime. Antibiotic prophylaxis, especially SBP, protein less than 15 gram per liter, child puck more than or equal to 9, offer prophylactic oral ciprofloxacin or norfloxacin.